A common term being used in implant dentistry for fixed teeth, the type that do not come out, is all on X. X being how many implants are going to be placed. There's no magic number. There's just a perfect number for you. The other way to fix your mouth is removable teeth that's supported by implants. Both ways give you gorgeous teeth. Both ways give you teeth that let you eat anything you want. Fixed teeth aren't going to chip, the teeth aren't going to stain, and they're not going to wear. Sounds great. They have one distinct disadvantage. They're hard to clean. So if the patient has the dexterity and they have the want to, I offer fixed teeth as my go-to procedure every time. But if I have a patient that have bad arthritis, maybe their vision is becoming poor, and I have to plan as their caretaker of their mouth the next 15, 20 years, I may know this person shouldn't have fixed teeth. They'll be hard to take care of. So those and many other questions have to be answered before we decide. There's 182 factors we look at on fixed versus removable. Here's one great reason why. Person's been wearing a denture 15 years. Bone and skin all collapse, right? Bone and skin collapse, the denture has a flange on it, maybe a ½ inch. Now they give them fixed teeth. Fixed teeth don't have a ½ inch flange. If you put a big flange, you can't clean it. We've had to take those out and give them a denture that's removable. Now they can clean it. Big difference. The case is going to fail, guaranteed. One of my biggest pet peeves in the failing implant case is the diagnosis of it. We need to know, why is this case failing? This person may have spent $15,000, $25,000 for this case. People come to me, they're upset. Why didn't it work? The number one reason I see is the case was underbuilt. If you're going to build a bridge across a freeway, all the engineering's going into it. The same thing needs to be done in implant dentistry. The case doesn't fail. The problem is they don't know what's best for their mouth, and that's what they need to know. They need to come in and be examined. You got to schedule first to do that. You got to make the call. But after you're examined, they need options. What's best for you? What I like to do is give the patient the most predictable longevity we can. So you need to call, make an appointment, come in, and find out what's best for you.